that I think probably all of us as clinicians have military families from time to time, and it's really more so than it used to be. It used to be that military families were cared for on military bases, but because so much of the military is now in the reserves, coming from the reserves, about half of all military families are being cared for in the private healthcare system. So even though we've got less than 1/2 of 1% of the U.S. population in the military, there are a lot of kids represented by those parents. So they've been 2 million children have lived through a parent's deployment, and almost 1 million of them have been through 2 or more deployments as well. So that puts kids at risk at every age. A lot of the kids are young because the people who enter the military are young, so they have young children. But adolescents are actually at even greater risk than younger kids in having problems as a result of their parent being deployed, and we'll talk about that a little bit more as we go along. So what's happened in the more recent military history in the United States is that there are more deployments and longer ones because there are fewer people in the military since there's no draft, right? And because both men and women are in the military, there's actually more family separations than there used to be and more relocations. In terms of losses and casualties, proportionally, they're more than they used to be. So all of those things are affecting our patients. And I think that some of the things about the military culture are worth sort of recognizing, and that is that people in the military, and by the way, my brother was career Navy and has only recently retired, and he stands out in our family in being very different in his attitudes about loyalty, about duty and patriotism. Not to say that I'm not patriotic, but boy, it can't come close to how patriotic he is. But also he and his wife, who actually went through being a military child herself, talk about how important the stiff upper lip is to military families. So everybody in the military knows that part of their job is to go into harm's way, and that dealing with military hardships is actually honorable, but that means that often there's sort of a lack of sympathy for the wimps, means the kids who have their own concerns about, many concerns about the hardness of living in a military family. Everybody is supposed to buck up and do the job. And in most cases, they avoid discussion about the potential for dying, for example. And, it's not just when they're deployed to be in a war zone. There's a lot of relocations and international moves and separations that go along with those things, even if you're not in a war zone. And those things are stressful for the parents themselves and certainly for the children as well. Another thing that I drew a lot of the information I'm going to tell you about from the American Academy of Pediatrics article, which is excellent, and it's in the references I'll make available with the slides if you're interested, is the real-time communication in war zones. So kind of like in that movie, American Sniper, which I specifically did not go to see, people are communicating with their families basically in real time. And the same thing is true for the journalists, that you're seeing things going on in real time. And for families, this is especially traumatic because they're more acutely aware of the immediate dangers at all moments, and even while they're actually communicating, they may be hearing gunfire, etc. So how hard is this on kids, and what does it do to them? Well, in one study that looked at the records of over 600,000 children whose parents were deployed, and comparing them to parents who were not deployed, there was an 11% increase in mental health visits for the children whose parents were deployed, and that was even high. It was especially high for the older end of their age group. Now, it's a pretty narrow age range, 3 to 8. There's certainly older kids affected as well. So overall, there were 26 excess visits to mental health providers per 1,000 person years. And the things they came in for, the main one was anxiety disorders. Shouldn't be a huge surprise because anxiety disorders are actually the most common mental health disorders anyway, but made worse by the fact that this is an anxious business to have your parents in the military. But behavioral disorders and stress visits were also represented much higher than for the people whose parents were not deployed. And so these are the kinds of symptoms that you see in kids whose parents are in the military, and that is 1 in 4 kids have depression symptoms, 1 in 3 have excessive worry, and 1 in 2 at all ages had trouble sleeping, all ages. So that's the little kids who don't even understand what's going on, but the older kids as well. So they're having a lot of trouble sleeping. And so what you see in younger kids are high levels of reactivity and anxiety and withdrawal. And in older kids, they also are at higher risk for emotional behavior problems. Now, I want to mention what you just described in the parent that you said the kids are just like their parent, they have ADHD too. And that is, it's not a random group of people who sign up to go into the military, whereas it used to be, right? Everybody got drafted. You guys probably can't even remember that, but Harriet and I do. But now, because it's a matter of people enlisting, people who may not have had a good career track towards academics, for example, or some other kind of profession, the military looks like a good option for them. And so there is more ADHD and learning disabilities in people in the military, although at this point all recruits have a high school education, so actually everybody graduated. But that means that not only is their parenting affected by those conditions, but their children are more likely to have them just because these are inherited conditions. The other things to keep in mind are that the military is inherently aggressive, and obedience is expected of the adults, right? And so those same things may carry over into the parenting that you see. So the research shows that there are certain risk factors for doing less well when you have a parent in the military. And those include when the parents aren't coping very well or having a lot of distress themselves. That's the most important thing. And that may be a male or a female, right? Because the female may be the one who's in the military, as in your family, Harriet, now. But those who were younger when they enrolled, when they enlisted, for whom it's the first separation from the family when they're deployed, who have been recently relocated, who have a foreign-born spouse, young children, or are at the lowest level, so the entry pay level, or are single parents, or have kids with special needs. All of the children who fit those categories are much more likely to have behavioral or emotional problems. And I don't want to forget to say the sad truth, which is that child maltreatment was up 3-fold, and neglect up 4-fold, and child physical abuse up 2-fold when one parent was deployed. So that's pretty scary, and it also tells you some of the things that you should be thinking about and looking for. So what's it like for that parent who's left behind? Or in this case, in Harriet's family, the grandmother and the aunt have been the ones left behind taking care of the kids. Well, of course, they're worried about the person who's deployed, and this status of being a single parent or a single caregiver comes on pretty fast, sometimes with fairly little notice, because you don't know when the deployment's going to happen. It's very common for people to be in financial difficulty. Even though we think we treat our military well, actually they don't get paid as well as you might think. So even though there's a paycheck coming in, there may not be another second paycheck, and that paycheck may not be very big. It's often socially isolating. Now, career military actually tend to do better, and their children tend to do better, because they have a very strong support system on bases. But again, a large proportion of military now are reservists, and they often don't live anywhere near a base, so they don't have that social support. And in fact, when one of the parents is deployed, the other parent may move back home somewhere, which takes them away from their natural support system that they might have had otherwise. And even though they try to keep a stiff upper lip, they may feel quite resentful and overburdened by what it's like trying to be a single parent. Depression around the perinatal period is actually twice as common, and you may know that postpartum depression already affects about 15% of mothers, so that would be more like 30% of them are depressed after they have a baby. And it's hard for them to get the support from the deployed parent, and in this case, the deployed father was actually killed, but when they're alive and deployed, nobody really wants to talk about troubles when you only have a 15-minute phone call. It's a very precious few moments, and You may not want to talk about the tough stuff, which means that the parents are more isolated in those feelings. So among the parents who were left behind, there was an excess of mental health diagnoses, 41 per 1,000, for shorter deployments, and the longer the deployment, the higher the rate, so 60 out of 1,000 if the deployment was more than 11 months, which is actually very characteristic these days. So can you tell which families are going to have more trouble during the deployment? Well, needless to say, if you weren't doing too well before the deployment, you're not going to do too well during the deployment. So a previous history of family dysfunction or mental health problems or children with special needs certainly contribute to higher rates of problems, but so do recent relocations and previous deployments that were stressful as well. So it might be useful to think about the whole process of deployment in different stages. And the reason this might be useful is because it helps you anticipate what kinds of things the family might be dealing with. So before they go, the things that they need to be working on are talking about what the expectations are for people, what they're going to do during the deployment, like how are the family members going to cope, and to try to make plans and goals for the family rather than just waiting it out, because it's typically more than a year they might be gone, and they can't really put their lives on hold all that time. And this decreases the likelihood of things getting distorted. Also preparing to be able to communicate and how often they'll be able to communicate, those are things to think about in advance. Now, during the deployment, which typically is 3 to 15 months long, that's when they carry out those plans. And it's an important time to develop new family traditions and keep going with the old ones. You know, you still have to celebrate birthdays. You still have to celebrate Mother's Day and Father's Day and Christmas and all those things during that time. And helping the kids understand how long the deployment is going to last can be helpful. But, you know, we're really now talking about school-age kids and older, because little kids don't have much of a sense of that at all. Now, during the deployment, they call this period the period of sustainment, where people are trying to keep it together, right, sustain themselves. And the most important tasks then are to establish support systems, and those might be other military families, but it could be a religious group or family support groups, to keep the communication going with the person who's deployed. One of the pieces of advice is avoid overspending. I thought that was interesting. I don't know what that means exactly in terms of whether this is a common pattern. And to make sure that the person who's left behind with the kids gets some time without the kids. So that means some respite, babysitting, as well as checking in on how everybody's doing. The kids, asking the kids directly, not just the parents. So one of the things that people often wonder about, and that's really part of Harriet's question, this mother is going to get a quote-unquote vacation to come back. And one of the things that can be surprising about those vacations is that they can be pretty hard on everybody. It may not be the wonderful, joyful event that you thought. And, of course, it may not happen during a school holiday at all. It can happen sort of arbitrarily and often without much notice. And what happens is we've got a parent coming back who may not actually know the kid very well anymore, especially if it was a young kid to start with. So they need to be sure to plan on getting back together and getting to know each other some more, spending time talking to each other, taking time to make decisions and be prepared for how things are different. Specifically, watch out for high expectations. So she's got this expectation of going to Hershey Park or something. Guess what? It may not go well. Hershey Park
without
is
medicine.
Without medicine, especially, right? They could be disastrous without medicine. So watching out for overly high expectations on reunion is really important, because it takes a while for the parent to sort of get back into the family circle, and that can be a real surprise to people. So those are some of the stages that you might expect. But mostly people do pretty well. Mostly military families do remarkably well. A few of them don't do so well, and those are the ones who don't have good coping skills, who may have a mental problem themselves, or who may have gotten into substance use, which is very common in the military, unfortunately very common. Now, the ones who do well are ones who really knew what this meant to be in the military and to be deployed, where there's community and social support, and where they have been able to develop coping skills, and where there's flexible gender roles, which I thought was kind of interesting. Of course, if a man goes off on deployment and the mother's left behind, she's got to figure out how to fix the clogged toilet, et cetera, so things that might be considered typical male things. So flexible gender roles helps. But those people who been married for more than 5 years, who had more education, and who had a spouse who had a steady job, those people tended to do better. So what are the kinds of behavior problems that you tend to see? Well, it varies by age. So younger kids are confused. They don't understand how long daddy or mommy's going to be gone. They tend to get the usual kinds of separation problems of clinginess, demandingness for attention. They may be suddenly angry, and they may, at the older age of preschool, feel guilty, like somehow they were responsible for the parent leaving. They don't have the cognitive ability to know that that's not true, but they may be especially irritable and aggressive. And as with other kinds of separation, there may be regression, like wetting the bed or sucking their thumb. Many, if not most of them, have sleep problems. Some of them will have feeding issues, and they can be easily frustrated, more difficult to come. Now, one of the things that struck me in preparing to talk about this today is that a lot of our families are having separations that cause these exact same things, separations from partners who maybe never were married partners, or divorce situations are actually more common than not, right? It's greater than 50%. So everything that you think about when it comes to deployment, most of the things you think about really are related to separation, and these are separation symptoms for young kids. If somebody's typing, could they please mute their phone? Thanks. So how about school-age kids? Well, they can have all those same symptoms, but they can have other symptoms as well. So they have a greater understanding about this, and they have more sadness as a result. They have more worry and can have rapid mood swings. They understand that parents may leave, or that the remaining parent may leave or die. They feel vulnerable to that, and they also know that the deployed parent may die. And in the case of these children, they actually had a deployed parent who died, so that must make them extra worried about their mom because she's deployed. And then they get typical sort of selfish feelings, like, I don't want my parent to be gone. I'm mad that they're missing my birthday. I'm mad that our life is so tough. Our life is so broken up by what's going on here. These things can come out at home, or they can come out with friends. So whoever's typing, please, whoever's using their keyboard, please mute the phone. And they can also get somatic complaints. And then adolescents, all of those things can happen with adolescents as well, particularly the depression symptoms. But one thing they may do is resort to clinging to their friends and staying away from their family life, or trying to take charge of the family. And that is made worse by the fact that they may be asked to take on more responsibilities. So if you've got a military family, you can use the same standard screening tools that you use for other parts of your pediatric care, but it's probably even more important to do that. And that means screen for mental health, screen for or ask about sleep, screen for or ask about maltreatment experiences, interviewing the adolescents separately who can often report on what's going on, and be particularly wary about maternal depression. So in addition to using screening tools, of course, you can simply ask, how are you doing with this deployment? First of all, make sure you know that there's been a deployment, and you're going to be doing that as part of your social history. Asking about anyone in the family or in the close community who's had wartime experiences, because they may have wartime experiences without being deployed, and asking how each of them is coping with this. There are other things that are particular to this situation that you may want to talk about, such as how much information the child is getting and whether that's the right amount for them. Would they want more information, or maybe they need less information? and particularly for school-age kids and above, do they have somebody outside of the family that they can talk to? Because the family is all sort of in this together and may find it too difficult to talk about their worries about the deployed parent. They have to kind of do this stiff upper lip. So having somebody outside of that group can be really important. So similarly to divorce information and anticipatory guidance, preserving the child's routines and the rules of the household and their responsibilities, trying to keep things as steady as possible so the kid can still do their sports, can still have their play dates, can still have their holidays. All of those things give the child much more sense of stability. It's really important to be open to the child's questions, but to give a consistent and preferably as optimistic as possible answer to them so that they're not constantly looking for that little chink in the armor where the parent breaks down and talks about how anxious they are at a certain time, that they can sort of be consistent about it's good. And, of course, from our point of view, we need to be watching for deterioration in school functioning or behavior. So these are some tips from that article I told you about from the AAP about important things to recommend during deployment, such as the frequent communications, a calendar to track dates, keeping photos of the deployed person around and talking about them, but not letting the kid be exposed to a lot of media about the war or outside people asking about scary parts of the war or when the child is around. Those are all important things. Making sure that the clinginess is not addressed with irritation, but it's addressed with extra attention, for example, special time, and the kid has an outlet for their emotions. When children are anxious or depressed, they may act out in a way that makes people punish them, and that's not really what we want to do. Instead, we want to give them a big hug or cut them some slack and try to identify for them. I know you're feeling worried, but we can't have you acting like this, so trying to be supportive about it and letting the teachers know that this is going on. Teachers can often be a big source of support for kids. Keeping the same level of discipline and responsibilities rather than increasing it is important. There's even a summer camp for kids called Operation Purple. So keeping the parents steady helps the kids stay steady, and that means helping the parents be part of community groups, sharing things about the child as part of the care packages and communication with the absent parent, and preparing people for the fact that things will be different when they get back from their deployment. And these are some questions they might talk about. So the last thing I want to mention is that when people come back from the military, they're not always the same person that left. That the rates of post-traumatic stress disorder and traumatic brain injury is really very high. Over 30% of returning soldiers have PTSD, depression, TBI, or more than one of those things, and half of them have trouble with aggressive behavior and alcoholism. So these may not be the people that the spouse or the kids remember, and it can be very difficult to deal with that. Many veterans who have PTSD don't get care, and the military system doesn't always make it easy, particularly if they're not anywhere near a base, which if they were in the reserves is probably true, or if they come out of the military and they're not just on leave. So some of the symptoms of PTSD that are hard for families include the anxiety, the anger, avoidance and withdrawal or substance use. And by the way, nightmares can be a real problem for people with PTSD. They wake up in the night feeling like they're under attack, and they leap out of the bed and sometimes grab their machete or whatever. It can be a big problem. Now, if you have brain injury, you may not be as employable at the same kind of work as you were able to do before, because you may have deficits in reading or concentrating or memory that really get in the way. And so all of those symptoms can make it really difficult to be with that family member again. So helping people start out with small, short, pleasurable interactions with their kids, getting the routines established. But one piece of advice, which I think is very valuable to think about, is the same advice you might give to an incoming step-parent. They don't know the kid well enough to be the disciplinarian, and it's better if they wait to be the disciplinarian until their relationship of affection and security has been reestablished. And that's a really good piece of advice for step-parents as well as for people who are returning from a deployment.
One other possibility in terms of a source of support can be school, not just kids that are living on a base and going to a school where most of the kids are military families, but I think even in some schools there are other kids that will have parents who are in the reserves that may be periodically deployed, and just knowing whether or not the school has any supports or experience with kids in that situation. Sometimes the guidance counselor has groups for these kids, and there may be other resources, even if it's not on a base.
That's a good suggestion. Do you ever find that the school puts kids like this into the acting out support group, and that's a problem?
Not necessarily. I mean, it just depends on how the youngster is presenting and what the issues are, how old they are. You know, I don't know that they all get lumped in any particular way. It really depends on how they're handling it. Some of these kids just get anxious and depressed, but I don't think that there's a consistent view of these youngsters as being disruptive.
Mm-hmm. Although that can be one of the symptoms they present
with.
So
right. It's one of them, but I don't think that's any more so than anxiety or depression or worry or avoidance.
Mm-hmm. Yes. And it's unlike other kinds of separations or bereavement, for example. You know, there's a course of grieving, but then you gradually get better and make a new life. In the case of the military, it's repeated separations and reunions, so that it's almost like you never get used to it is one of the possibilities. That plus the fact that everybody says, oh, you must be so proud, or we're so proud, thanks for your service, instead of, gosh, that must be awfully hard.
The other thing I've seen is, especially now that we have both parents being in the military, and these kids who are ADHD that was mentioned in the case, I find a number of military parents having a little trouble with the part of ADHD temperament that, when they have transition difficulties, they don't come right away, and interpreting that as insolence, as you might in the military, and sort of getting into it by being the drill sergeant for the kid kind of stance, and finding disrespect when it may not really be there as an issue. And what I found is that you don't have that's a proneness that the military parent may come with, and the other parent non-military parent would offset that, but not anymore. I've got both parents are police people or soldiers, and that's an issue to look for in kids like that.
Unreasonable expectations for prompt responses,
military respect.
Military respect and
Salute.
The authority position.
Yeah, and it sort of begets some oppositional sort of challenges. The kid who's 4 years old who says his father's dead, I just want to comment one thing. We do this, have kids do human figure drawings, and we ask how it ends. The kid says the person died. What happens to the kid? The person died. Half the time when you say, so how's the story end? Oh, he gets better and goes to hospital and things work out. And that's actually a good response. So just because he reports, uses the word dead, doesn't mean that the child actually has the idea about irreversibility to surprise you. Mm-hmm. So